We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers increasing again throughout the country as well as here in Orange County, we recorded an all-time high in the number of new COVID positive cases, nearly 1,400, due mostly to the Delta variant. Now, many residents are questioning what we should do next. Orange County government is suggesting that all residents, even those who are vaccinated, wear face masks again while indoors. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Our first guest is the very busy Orange County Mayor Jerry Demings, here to give us an update on what's going on here in Orange County. Mr. Mayor, thank you for being with us. You know, we were doing so well with the vaccinations, with all of the testing that was going on. What happened?
Well, that's a complex question, but let me just start out by saying thank you for having me on the show. We were doing exceptionally well. We were below 5% in terms of our rolling positivity rate for well over a month. But here's what happened to us here within our community. I believe that to some extent we got complacent with getting vaccinated. We were not moving the needle fast enough in terms of getting persons in our community vaccinated, number one. Number two, we could not have predicted the fact that because of the rapid spread of COVID within our community, it created an opportunity for mutations to occur, and a much stronger variant of the virus erupted within our community, and that has contributed to the significant increase that we now see, nearly 1,000 individuals each day testing positive here within Orange County. We now have surpassed over 164,000 individuals who have tested positive over time, and nearly 1,400 people, unfortunately, have lost their lives to this virus. This week alone, we had one of our corrections officers who died of COVID, and that's sad. We have several other of our employees who are critically ill, who are in intensive care units within our hospitals here within the region. And so now is the time for us to kind of band together to increase the rate of individuals getting vaccinated within our community, number one. Number two, we have to return to wearing facial coverings, because not only is the virus infecting those who are unvaccinated, but it is also now, to a much lesser degree, infecting those who have been vaccinated as well. So we all need to mask up now when we're in indoor spaces and crowded spaces. We should be wearing our facial coverings at this point.
And also, this is the time to, if you have been on the fence, to go ahead and get vaccinated. Tell us about the partnership with Barnett Park and how we're getting these vaccinations done here in Orange County.
We have continued to offer both free testing and free vaccinations at Barnett Park on a daily basis, 7 days a week, primarily between the hours of about 8 a.m. and 5 p.m. each day. However, if you really want to get vaccinated, because the lines are so long, you really need to look at getting there no later than midday. We look to open up a secondary site to do testing and vaccinations sometime within the near future. We're working out the logistics at this point, so hopefully by early next week we'll make an announcement about that.
How are we working to make sure that both rural and urban underserved communities have access to the vaccine as well?
You know, I'm glad you brought that up, because I should have mentioned that, because we have mobile vaccination opportunities throughout our community. We're moving the I Got My Shot mobile vaccination trailer throughout the county to ensure that we get into some of those underserved communities. In addition, we are partnering with local healthcare organizations, local faith-based organizations, as well as community-based organizations to do mobile vaccination sites in partnership throughout the county. In addition, our retail pharmacies continue to offer opportunities to get vaccinated. Those are primarily the CVS types of pharmacies and the Walgreens here within our community. So if you don't have an opportunity to get to one of those, we have many of our freestanding clinics, our walk-in clinics, the Central Cares of the world. They are also offering the opportunity to get vaccinated.
And is there still a push to encourage people to get tested for the virus here in Orange County?
Absolutely. We're going to continue to offer free testing for the foreseeable future, primarily because individuals really want to know their status, and we want them to know their status. So we have to increase, I believe, the testing within the community and the rate of vaccinations. There's a bit of good news here I will share with you, Clarence, because within the last few weeks, because of this extra emphasis we have been putting on getting vaccinated, we have seen an uptick in the rate of vaccinations. Within the last few weeks, 60 to 70% of those who are getting vaccinated are doing so, they're getting their first shot, whereas a month ago, probably 30 to 40% of those who were getting vaccinated were getting their first dose. So we kind of flipped that around. So I want to say thank you to all of Orange County for hearing our appeals and going and getting your vaccinations.
Mr. Mayor, a lot of people don't realize that in an emergency situation, circumstances change and you have to change with the circumstances. So just so that we hear it from you right now, what are the mask recommendations here in Orange County?
Here in Orange County, we're asking our businesses to really go back to where we were just a few months ago, and that is requiring their patrons and their employees when they're indoors to wear facial coverings, especially when it's in a crowded setting. Even outdoors, if you're in a crowded setting, you may want to consider wearing a facial covering as well. This is consistent with the new amended Centers for Disease Control guidelines that have been pushed out this week, where they too are recommending that individuals and indoor spaces wear facial coverings. And that's the best way that you can really protect yourself while we are going through this slight uptick. And by the way, 90% of all of the communities across America are seeing an increase in the rate of those who are testing positive. 35% of all counties in the nation are now listed in what they call the high risk for transmission of the disease within America. And so we're not alone. All of Florida essentially is now in the red category, the high risk category. So what we're doing here, however, in Orange County, we now recently said that not only do we as a county government want to have our employees get vaccinated, but we want businesses here within our community to strongly encourage or mandate that their employees also get vaccinated. And we also want our businesses, again, to offer the opportunity for people who patronize our businesses to come in and wear facial coverings. So those two things together should help us to protect everyone as we move forward. Unfortunately, we didn't have a lot of options in terms of trying to reduce the spread of the virus and increase the rate of vaccinations. That's why we had to make some decisive action. So we reinstituted a state of emergency here within Orange County that will last for the next 7-day period of time. And then we'll look at it, and we're likely going to have to renew that state of emergency, because I think that we're probably several weeks away from reducing that number back down to a manageable level. We are seeing positivity rates on a daily basis as high as 19 or 20% throughout the county. At one point, we were at a very low rate. We had like 3.4% positivity rate, and we had a sustained positivity rate for several weeks well below 5%. So when we see these double-digit numbers that we're seeing now, it's a little discouraging. But if we all work together, if we come together and do our part, we'll be able to get these numbers back down quickly.
Mr. Mayor, there are a lot of people who are still dealing with the impact of the pandemic. So is the emergency rental assistance program still available for those who need it?
The Emergency Rental Assistance Program is still available here within Orange County and will be available for the foreseeable future. And that becomes very important because as we approach the end of July, the eviction moratorium is slated to expire here within the U.S. And so we don't know if the President or if Congress will extend that or not. So I still encourage everyone who may be struggling with making their rent payments to make application. If you live in unincorporated Orange County or you live in any of the municipalities other than the city of Orlando, you can go to our website and make application, or you can simply dial 311 to get information about how to apply. If you live within the city of Orlando, you really need to go to the city of Orlando's website. They receive their own direct allocation from the federal government, and so they're administering their own program. But if you live in unincorporated Orange or any of the other municipalities within the county, you should call Orange County to get the emergency rental assistance.
All right, Mayor Demings, thank you for being with us today and keeping us up to date.
Thank you for inviting me, and I look forward to these numbers coming down in the very near future.
And we'll be right back with more. Stay with us. Let's get an update from our state medical professional. And joining me is Alvina Chu, epidemiologist with the Florida Department of Health in Orange County. Alvina, always good to see you. Thanks for being with us.
Thanks for having me again.
So, tell us where we are in the state here in Orange County as it relates to the coronavirus numbers and what's transpiring right now.
Well, so what's happening in Central Florida, so here in our county, is also reflected in our state numbers and then also nationally, which is we've just recently had the highest number ever of cases reported in a single day. Also, we are at peak hospitalizations, and so that part is, it's hard to say as an epidemiologist working on a pandemic for over a year, but that's currently the state of where we're at.
So what do you think is behind the rise in numbers? How did we get here?
Well, one part of it is, so I say peak numbers, so highest ever. So we have surpassed what the numbers that we had in the winter, which, when January and December were around, we thought that was pretty much the worst ever. The thing that's different now is we have the vaccines, which has made a tremendous effect in reducing severe hospitalizations and deaths in those who are vaccinated. Part of why we're where we are, I think, is we haven't been able to vaccinate nearly enough people to be able to get a handle on the pandemic and really reduce transmission. And part of that transmission is that currently the Delta variant of the coronavirus, the virus that causes COVID-19, is now the dominant strain circulating inside the United States. At last report, it was greater than 90% of all infections in the U.S. Were due to the Delta variant, which is highly transmissible.
So yeah, let's talk about that Delta variant. Is it actually much more severe and much more communicable than the previous variants that we've had?
Right. So actually two separate questions. So is it much more severe? So it doesn't seem to necessarily be more virulent in that the disease that you have causes a more severe illness. It is significantly more transmissible. So I was just talking to a mom of kids, and she tried to explain this to her children in words. So essentially, recent studies have shown that with the Delta variant, you may produce up to 1,000 times more viral copies in your respiratory tract than with the other previous strains. And essentially, boiled down, it means that you make more cooties when you're infected with Delta than with the other strains, and thus you're able to transmit easier. Also, some genetic features of the Delta variant have make it more able to easily infect human host cells. So there's a couple of features of that which make it spread much faster. Way back in the beginning of the pandemic, we were talking about the R0, which is an epidemiologic measure for infectivity, and it was thought that R0 was approximately a little over 1 to 2, meaning that one case infected, say, 1 to 2 people, or maybe 2 to 3 in certain scenarios. Currently, some recent studies have shown that the R0 for the Delta variant may be 8 to 9, meaning that one person could infect 8 to 9 persons. And this would put Delta on the level of infectivity of something, say, like chickenpox or the measles, which we all know to be highly infectious.
So as we're thinking about the Delta variant, what about people who have been vaccinated and some of the changes that are happening with mask mandates and what we should be doing so that we aren't both spreading it or contracting it, either way?
So currently the vaccines that we have are still highly effective at preventing severe hospitalizations, severe illness outcomes, and even preventing deaths. So we had mentioned previously that currently all the new infections that are occurring in our county, at least, those are greater than 98% of that. Those new infections every day are in persons who are unvaccinated. And so the vaccine helps prevent us from getting it, although it's not 100%. The vaccine prevents us from becoming severely ill and potentially from dying. And so it is recommended that everyone still get the vaccine if you have not yet gotten it. This will help us reduce the numbers of transmissions, or help us reduce transmission overall, and also help prevent severe outcomes. So also some recent studies that are occurring, which will soon be released by the CDC, are some data that it is possible that a person with a breakthrough infection with Delta may be able to spread it to others. And so this is the change in the CDC recommendation for mask wearing, especially if you are in a household with persons who can't be vaccinated, and especially if you are in close contact with those persons who either may not have built up a great immunity, so those who are immunosuppressed, and those who are at the highest risk for severe illness outcomes, so persons who have other comorbidities or our older population.
And talking about the variant, for those people who have been vaccinated, I want to get clarity to make sure that they understand that it does also protect you against contracting the Delta variant, and also might we need a booster if you've been vaccinated at some point in the future?
Yeah, so the vaccine will help with preventing illness. And help prevent infections, although some infections may occur. And those infections, so if you are vaccinated and then you become infected, it's more likely that you will have either an asymptomatic or a mild infection. The chances of breakthrough illness progressing to severe hospitalization or death is very, very small, and in the single digits and less than 1%. So there is this potential. So as we talked about before, our race to get most of our population vaccinated now impacts whether or not we may need boosters in the future. So the vaccines that we have currently been shown to have a good immunity, at least 3 months. The CDC guidance that is referenced is there is no end limit at the moment, but some studies have shown that it's been good for a year. We haven't had the vaccine that long, so it's a little bit hard to predict. So the initial studies are based on clinical trials. But if we do not get a good handle on the pandemic now, all the new infections that occur give the virus an opportunity to reproduce and potentially gain mutations that may eventually be able to evade the antibodies that we produce from either the current natural infections or from the immunity that we have built from this vaccine. And so this is the concern that's looming down at the end of the path if we don't get a good handle now. Is viruses, what their goal is, to infect people and mutate, or find the best way to infect a person. So they will evolve as they need to, and they will evolve in unvaccinated persons. So the greater the population that is unvaccinated, that is essentially the incubator for mutations.
Oh, my goodness. And so, how is Florida doing in its efforts to get children ages 12 to 17 vaccinated before the school year?
Well, within Orange County, we're really working very closely with our Orange County Public Schools to be able to have the vaccine available to that particular age group, the 12 to 17. So working with them to have locations that are convenient for parents and children in middle schools and high schools.
And just finally, what is your opinion on what we should be doing to get the word out about vaccinations, their safety, helping people who are hesitant to move them over that line? What are your recommendations for helping?
So I really think getting good, accurate information out there is important. So I recently did a couple of webinars and town halls, so open-ended questions for the general public to ask. And we went through all the myths that you and I went through previously. We talked about the 5G cell towers and the nano chips and the magnetic arms. But I think if we're good advocates for accurate information, I think we could help maybe get some people vaccinated. I think a lot of people have questions that go unanswered. And instead of getting them from good resources, they may either find unreliable resources or just rely on word of mouth.
Yeah, some of the most important voices are not the loudest, which is unfortunate. Alvina, thank you for being with us today and for giving us and keeping us informed from the front lines of this pandemic. We appreciate your time.
Thank you.
And we'll be right back. Stay with us. From cures for coronavirus to phishing emails and phony websites, scammers are taking advantage of consumers' fears as the pandemic continues to impact Central Florida. Mark Batchelor with the Cybercrime Support Network is back to talk about the medical disinformation, phony cures, and medical imposter scams that are out there. Mark, thanks for being with us today.
Thanks for having me back.
So what are we seeing in the form of medical disinformation that I wanted to note that people are profiting off of that, but it's getting out into people's inboxes? What are we seeing?
It's getting there fast because what we're seeing is amplification. This pandemic seems tailor-made to spread on the internet, the false information, and it spreads more quickly even than the true facts and the facts of things that can actually help people's health. Can travel. In fact, the American Medical Association in June had a call special session just to discuss the impact of misinformation and disinformation on public health.
Yeah, and a lot of people don't know, is there a difference between misinformation and disinformation? And if so, what is that?
There is, and they're similar, but it's largely a difference of intent. Disinformation is false or misleading information that can be spread with bad intent. It's spread intentionally. So those scammers you're talking about, people are making a profit. Maybe they'll pretend to be a medical professional and they want to sell you something, or they have other nefarious things in mind. Whereas misinformation includes that, but also information that is false but spread not by bad intent. Sometimes you'll get a family member share something on Facebook with you that has dubious information. That's misinformation. They don't mean to do it. They want to help you, but it still ends up doing harm unintentionally.
And what are some of the phony cures and vaccine alternatives that you're seeing spread on the internet these days?
We're seeing a lot of what are called imposter scams, and they go very well with medical scams. So we're calling medical imposter scams. And what we see are things like fake online storefronts that are selling miracle cures or selling vaccines when people thought they couldn't get vaccines more readily. We're also seeing people who are still charging fees for testing. And as we know, the Orange County Health Department right here, you can get that for free. You can find all that information. We're seeing also online pharmacies that pretend to be from Canada, but they may be from Russia or somewhere else. Because people are looking, they're a little nervous about the cost of prescription drugs, so they're looking for a deal. And the danger there is if they get something with no active ingredient or the wrong active ingredient, that could be harmful or even deadly to them.
And are scammers starting to mix the traditional scams that have been going on for a long time with the medical scams that are sort of emerging now?
Yes, some of those scams that have been around a long time have been doing so because they work. So what we're seeing are things like debt collection scams, which have been going on before we had the internet and cell phones. But since people have now a lot of medical debt, especially with COVID, there's that opportunity there to make money. So people will call and try to harass or bully people into paying or giving up private information in the hope that they'll go away. We also see things like charity scams, which are especially nefarious. Everybody now wants to help their friends and neighbors, especially in a time of need when there's sickness. So if people say, do you want to help frontline workers? Do you want to help children? Your answer is always yes, but you have to make sure that that charity is vetted. And of course, that's legitimate. So you can go to Charity Navigator and check out a charity that way, or just ask what the specific charity is. I think Cigna has a fund for frontline workers and their families. What you would do is go to their website and find out the appropriate and safe way to donate.
And what kind of tools are the fraudsters using to scam people these days?
They'll use any tool in their toolbox, but the two most popular are phishing attempts, which is sending an email that looks legitimate to your inbox and it looks like it comes from Amazon or somewhere else that you do business with, trying to get you to click on something or go to a website where malware will be downloaded or maybe even ransomware nowadays. So we have to look out for that. And of course, our phones. Our phones are ready-made because not only are they calling like they used to before cell phones, but now they're texting us, they're emailing us on our phone, and they're doing so through numbers that look legitimate. They can do what's called phone spoofing and make it look like it's coming from someone you trust. So we really have to be careful.
And what are the scammers? Who are they scammers profiling now for targets? Are they looking at certain demographics of people?
Yes, well, health right now is on everybody's mind, so there's a lot of opportunity there. Generally speaking, when we talk about health scams, our older population is more susceptible or more targeted just because they're more likely to use the healthcare system. Medicare scams are very popular, so people are targeted in that way. Plus, there are great things about being an older adult. Maybe, we have a little bit more savings. Maybe we have a vacation home here in Florida from somewhere else. These are things that scammers want to get their hold on. So what they're going to do is look for ways to exploit that.
So with all that we've learned, what can we do to protect ourselves from scams?
First thing is to slow down and do your research. If something sounds too good to be true, it probably is. If something is, you get an email or a social media post that seems like it's tailored to make you angry, that's probably also something bad. So do your due diligence. If the information's not coming from a trusted source like the health department or elected official or somebody in the public health field, then you want to kind of question that. Also, never pay anybody by gift card or by cash because that can be spent away and you'll never get that back. And there's a trend now with people who are getting vaccinated. I'm glad they're getting vaccinated, but they're showing their vaccine cards on Instagram and Facebook. And that has a lot of information. It has your name, your birth date, the lot number of the vaccine. So people can use that information to try to scare you into giving them information or money.
And how can we learn more about the scams that are out there the medical scams, the COVID scams, and scams in general that are out there?
There's some great resources. I'm going to plug ours first. Our website, cybercrimesupport.org, has a regularly updated blog for vaccine scams. So anything that's coming out in the news, we're going to post there so you know about it. We also have scamspotter.org, which is a way to learn about those phishing scams, and fightcybercrime.org, which is a way to find help if you have it. But largely around here, our Orange County Health Department is a great source of information about vaccines and about testing. Your county and state elected officials are a great source of information because they're up to date. If you have been scammed, also the FTC has a COVID pipeline, and the Justice Department at justice.com/coronavirus is also a way to report scamming, and reporting is so important.
Well, Mark Batchelor, thank you so much for being with us and sharing what is very important information. We appreciate your time.
Thanks for having me again. Appreciate it.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus, from local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve our community. And of course, we are also here to help you keep making those healthy connections. Stay safe.